if you take note, you'll see that it's swollen kind of around the perimeter of the actual pimple itself. There are a couple reasons for that. One is I've been manipulating the tissue, pressing on it, and the normal response of tissue is that, you know, some extra fluid will accumulate, but not pus, not blood, not anything like that, just skin fluid. Another reason is that we've been sucking up on the tissue, so that we've actually deformed the tissue very temporarily with the device itself. And there's another little tiny pimple developing down here which accentuates the appearance of it all. But that will resolve before we're even done treating this. That will be completely gone. So I'm going to move on up to this one. Okay, so we're going to do a manual extraction because I already went over that with the device. Now obviously you can't use the device at home, but with manual extractions it's an easy enough thing for any of you watching to go and buy yourselves a manual extractor. But what I'm telling you is, if you try to do this on your own, all that stuff that's in there, you're going to manage to simply drive it deeper into the pore. And when you do that, you're going to break through the bottom of the pore, driving that down deep underneath the surface of the skin, possibly even into the subcutaneous fat, making this whole condition far worse than it needs to be. So we're just going to press on the skin around it again, and you can see already stuff from the pore is starting to come up. And we just slide it across and lift that off. So real extractions don't feel good, but they're very, very effective methods of getting rid of these kinds of pimples. And with the right home regimen, patients can do a great job preventing the reoccurrence of these. That's all pus that's coming out, all
so
infection.
That means there's still stuff in there?
Doesn't mean that there's stuff.
Because it looks pretty clean now.
Sure does. There's still a little bit in there. Actually can feel it. When you do as many of these as I've done, you can feel it with the tip of the extractor.
What, just like something's blocking it?
It just feels different when I press on the skin. So I know that there's still something in there. But all that liquid is infected. And that's why it has that yellowish overcast to it. When we're past the point where we're getting out that liquid, there'll be a little bit of blood, and then we know we've made progress. I'll come back at this with the device, give it one shot, just to make sure we've sealed everything up. And that's how you do extractions. And while we're here, let me get this thing. Just press down around the perimeter and grab that right off the surface. And that's done. And this can be done on the tiniest of pimples. It can be done on the biggest of pimples. So I'm going to come back. I'm going to do one pulse of the device on this, and then we'll move to the other side. I'll show you how you do this on a larger one.
How to isolate or do extractions?
Both. No? How am I doing?